Globally, it is the fourth most common type of cancer in women. In Africa, it is the second. But as scary as it might sound, it is one of the most successfully treatable form of cancer. In honor of the Cervical Cancer Awareness Month, which is January, I present to you cervical cancer. To begin with, what is it? Cervical cancer is a type of cancer that occurs in the cells of the cervix, which is the lower part of the uterus that connects to the vagina. For the non-medicals, the uterus is what is commonly known as the womb, where the gravity conceives a baby. Its lower region, which connects to the vagina, is called the cervix, and when it becomes cancerous, we call it cervical cancer. Well, why does that happen? What are its causatives? The prevailing cause of cervical cancer is persistent infection with the human papilloma virus, HPV. HPV is a sexually transmitted disease in which approximately 80% of all sexually active individuals would have had it at one point in their life. But HPV is usually not harmful. Most people get rid of it without any medical intervention, except in small instances where it progresses to become precancerous, and if not noticed and action taken, it becomes cancer. Although the likeliness differ from individual to individual and from population to population. For example, people with compromised immune systems, such as HIV patients, are 6 times more likely to develop cervical cancer than those without. Smoking increases the likeliness. Intercourse early in life, having multiple partners, and in a broader scale, it is prevalent in developing countries than in developed. So, how do you know that you have cervical cancer or someone around you has cervical cancer? Well, the bombshell about cervical cancer is that the most common symptom of cervical cancer is no symptom at all. Although when advanced symptoms could be vaginal bleeding with an unpleasant smell, vaginal discomfort, pelvic pain, pain while urinating. But to know beyond a shadow of doubt, you need some diagnostic tests such as the pap smear test, HPV test, that is the human papilloma virus determination test. Biopsy and colposcopy are also used for the diagnosis. Now to the most important point. How then do you prevent yourself or others from having HPV? Approximately 90% of cervical cancer can be prevented through regular screening exercise, preventing having multiple partners, and vaccination early in life. And the vaccination not only to girls, but boys as well, for majorly 2 reasons. One, although it's a topic of a different day, HPV can cause penile cancer in men. And second is because boys, of course, with time, are the subject of transmitting it sexually to females. So they need to be vaccinated. And one more is to quit smoking. Finally, for the relief, although cervical cancer is one of the most common type of cancer in women, it is also a slow progressing cancer. And approximately it takes about 15 to 20 years for cancer to develop from precancerous cells. So chill, but still prevent yourself and people around you from having cervical cancer by simply keeping yourself and them informed.